So today, what am I doing today? I'm gonna go to Pilates today, and then I'm gonna go see my dermatologist, Dr. Emer. I don't know if you had seen before, I have what's called a thread lift, but I'm gonna get another one. I'm really happy with the results. And I'll explain more, or I'll let him explain more later. But we're just gonna do a little bit more, and it's just me being really picky. Just a little bit more right here. And then I need some Botox in my chin. I'm not getting it here or here because I'm not really concerned with it. I do get it there, but not all the time. I'll probably go like 6 months without doing it there. But I don't like the way my chin crinkles up like that. I don't know, when I talk it's a little, I don't know, it bothers me. It bothers me, so I'm taking care of it. So yeah, I'm excited to see him. He's literally the best. I'm not letting anyone else touch my face. He's the best. So I'll see you guys in a little bit. Hey guys, it is several hours later. I went to Pilates. It was good. I've kind of been having a stressful couple of days. And I hate to like complain and go on rants and things like that, but I mean, and I might not even add this in the video. I just hate being negative. It's not really negative, I mean, I guess it's just talking about what happened. And maybe a lot of you won't understand, but it's a pretty big deal to me and to people who their livelihood is social media, and mine is. It's part of my job. It's part of how I get booked for cam shows and how I can advertise my premium Snapchat. So anyways, I'll get to the point. A couple days ago, my Instagram account, which I had just reached 1 million followers, I was so excited, got deleted. It said for violating guidelines. Now, this happens to every girl at least once in the industry because of, you know, the nature of we are in the adult industry. If you follow me on Instagram, you know I keep mine really PG. I really don't post anything that could be offensive. It's all within Instagram guidelines. I kind of keep my look more as like, oh, she looks like an Instagram model. Oh, she happens to be a porn star. Not like I look like a porn star. So anyways, I put a lot of time and effort into my Instagram. I spend a lot of money, a lot of time, and now I'm losing money because it's gone, and I'm trying to get it back. I'm trying to recover it. Most of the girls are saying they've gotten their page back, so I'm just waiting. But I had created a backup account just because so I could have something, and they just deleted my backup account too because I guess when it's signed up on the same IP address, it's a red flag to them. So I'm trying to remain positive, and I'm giving it a week, and I'm hoping I get it back within that week. Yeah, I mean, I should. I hope so. Fingers crossed. It's sad because it's haters that report things that don't need to be reported. So it's unfortunate. This one's freaking out. You hear someone in the hallway. All right. I gotta go. Bye. Hey guys, so I'm at Dr. Emer's office, and I just took a bunch of photos. That's why I'm wearing this, like before and after photos. So obviously the before photos. And I didn't mention before, but we're gonna do this like laser that tightens skin, but we're gonna do it on my stomach because who doesn't want to tie their stomach? I mean, I have a pretty good stomach, but I don't know, kind of just want to get like snatched all over. So it's supposed to be painless. Here it is. Just radio frequency that heats up the skin and the muscles and tighten them up. So with working out and plus other things, you can look fucking snatched, but you have to work out too, otherwise shit doesn't work. But look at how beautiful his office is. This is just one of the rooms. So pretty here. But yeah, I'll see you during the procedure.
It's called Body Effects, and what this is a radio frequency device that heats up the tissue and creates a thermal injury. And the reason we want to injure the skin is so that we can get a healing response. Now with that healing response, we are giving an influx of collagen production and helping to tighten the area. As you can hear, it kind of vibrates and it sucks the tissue up into the machine, and it allows us to deliver that heat. So similar to some of the other devices you've seen us use, except this one just stays in one place. It does all of the work with that suction and the vibration. So right now we are at 35 degrees. We want to get up to 40. 40 is our therapeutic treatment for skin tightening. Above 43 actually creates lipolysis, which is fat reduction. So this can actually be used not only to tighten the skin, but to reduce fat. So that's body.
All right, guys. Hi, we're back. Dr. Emer in West Hollywood, and we're just gonna do fine contouring of the chin. I think the in area right now that women are really capitalizing on anti-aging is the chin and jawline. So what we're gonna do, if she looks to the side, you want your chin to be pretty much in line with your lower lip, so you don't want to go too far. But if you see here, she has a little indentation here and a little softening on one side. So all we need to do is just subtly correct that. And again, it's not always about volume, it's more about proportion. Like even that right there, a small bit of the rest of the product. And now what we need to do is put the projection wise, she's good. Now we're just going to do that. We don't want to widen it. But we do want to soften this transition zone. That's almost, I think, it. So as you guys see, we didn't really do a lot of deep volume. We just did that fine tuning of that small area.
Okay, so I look a little bit crazy. I did some injections in my chin and Botox, so it looks more even now. He marked me up so that he can do the threads over here. And yeah. Can't wait. He's the best.
Hey guys, it's Dr. Emer, and we are in West Hollywood, California, and doing one of my favorite treatments. And it's very, I hate to say a hot topic right now, threading, but it's kind of like the what's in and what's out treatment. So threads were very popular for a short time period many years ago, but they weren't nearly as good as the ones that we're using now. Here I'm using a thread called InstaLift, and this is what's called a bidirectional thread, meaning that we go from one end to another end from the midline, and that allows me to tighten and lift from an anchor point, meaning that when this goes through the skin, we can lift the skin from this middle central location. That allows me to get a snatched look or a contour, a vector. So we're doing that right now on my beautiful young patient. She is all about prevention, just like we are in our practice. And what does that mean? So for one of the things we know happens with aging is laxity or skin sagging. And the only treatments available for that are skin tightening external treatments such as thermodural therapy, and then things that build collagen over time and kind of lift the tissue like this, threads. It's really all we have. Otherwise, you're going to need to do a face or a neck lift early on, which there's nothing wrong with. But if you want to prevent the surgeries, then this is your option. So we are going under the skin, and there's little pinches that she feels, but it's not too bad because there's some numbing. And this is in predetermined areas that we have identified would give her a nice area of lift and the tight look that she's looking for around her jawline. Hold on one second. And lip corner. And you can see they go in relatively easily, and I'm able to literally lift the tissue from an anchor point. Go ahead and hold tight. Back. We've already done this once a few months ago, and she did great. Now we are going to fine tune and add more. There's nothing wrong with that because these strands are made of a material that builds collagen and dissolves into the skin. Similar, very similar to a product called Sculptra that people know I love to use for tightening. Hold on. Go a little deeper here. Any questions or anything so far?
Not yet.
No? No?
Mm-mm.
It's fine. They will.
Any questions, guys?
We have some great videos about this procedure. Let's go a little bit more superficial. Hold on. On my YouTube. But people that don't chime in now will later.
How much does this cost?
All depends on the number of threads and who's doing it. It can range from 2,500 to 5,000 in area sometimes. These threads are made of a material that stays in the skin for up to 2 years. So technically, if you do a nice amount of threading and get a good result you're happy with, you really only need to do this a year or two later.
What's the downtime with this procedure?
Well, there's really none. There's very minimal swelling and bruising. Turn all the way to the left. However, every so often, people will have a little pucker in the middle portion here that we're puncturing right now. And that pucker means more skin tightening. So if you feel embarrassed by that little pucker, then you have a little downtime because you're going to hide at home. If you're willing to just sacrifice and say it's in the name of beauty and maintenance, then you're at the gym the next day and you don't give a crap about what everyone else thinks. That's what I do. That's what you do. But some people are a little crazy when it comes to that, and they might want to hide for a few days for the swelling and the kind of puckering to go down. But the longer you have that puckering, the more anchoring points we're going to get and be able to really get more definition and stuff and more tightening long term. And for her, she's very sensitive to numbing medicine, so we only used a little, and she's still doing very well. Go ahead and grab. Thank you. I've also had people criticize the way we do this treatment online. I'm dermatologist trained and did Mohs surgery, which is skin cancer surgery. And when we do Mohs surgery, and all the stages we do Mohs, we do what are called clean gloves. You can see these types of gloves, not sterile gloves. So I had someone write online, how could you do this without sterile gloves? You're puncturing the skin, you're doing this, you're doing that. A lot of studies show that, hold right under here. A lot of studies show that sterile gloves do not do that much for infection in very non-invasive treatments like this, where you're not cutting the skin. So actually, it doesn't do much for the patient. And in the thousands of cases that we've done, how many infections have you seen? Zero. So with that said, hold on. Oh, no. Come on. Hold it below.
Another skin doctor said, "Good, thank you. I do it too."
I do it too. Yeah, I mean, there's a waste. It's a waste of money. It's a waste of resources and time. In my opinion, if you clean the area and you do this well, you can do this with a clean glove. And that's totally fine. And again, there's an art to medicine and something called the practice of medicine, meaning that you live and you learn through experiences, and not everybody does everything the same. There's nothing wrong with that. But I'm really trying to get her the tight look she's looking for, so we're pulling really up to this anchor point around the jaw. Good. Go ahead and let go for a sec. There's one little area bleeding. That's easy. We'll stop that from above. Go on the other side of me. And we're going to put in the last thread, and then we're going to tighten. Hold right there. So in general, a nice cleaning with both alcohol and hibiclins and proper technique, and you're fine. We've done thousands and never had a problem.
Is this effective in the chin area and the neck area?
Yeah, it's great in the neck. We love it in the neck. Chin-wise, I'm not sure what they mean. We're working right now around her lip corners and the center part of her face, or the lower part of her face that she wants to just pull back. Most women obviously feel that jowling starting to happen, and she wants a lot of tightening along her jawline. So if you see here, I'm clustering the anchors here laterally to a closer point than I am to the midline. If you see, the midline is spaced. So that's going to allow us to get a tighter look. Now, sometimes these need a little more help to get in. Give that the help it needs. So that's all based on measurements that we did for her face, because we want to keep her face beautiful and perfect. Okay, so now let's raise her up. We're going to raise her up and we're going to tighten those threads. I don't think we're going to have much puckering this time, which I think is really good. But yeah, you know, everyone wants to criticize, but let me explain to you that I do this multiple times per day for years. So if you want to criticize when you do more than me. You know, look on all the way up. Good. I hate to say that because I'm not that type of person, but I get a little sick and tired of people, you know, being rude. Should be nice, you know what I mean? Be nice and help others. So here we are tightening, and if you see, look how much tightening we're really getting. Oh my God, that pulled back great. It was like an inch. So she really wants along her jaw. So look up again and look to your left slightly. So look, when I pulled this here, see how the tightening comes all the way back to the angle of the mandible? That's really what she wants. So a real tight pull. She's going to feel this a little bit, unfortunately, but we need to. We're activating the cones. Activating those cones, really anchoring them down to the skin. Okay. And even though you do see these now, some tightening there, you can see the tightening effect. She's going to really notice this in a few more months. We do that same thing here. Turn to the right a little bit. It's a little anchor. It's always that one spot on you. I don't know why. So everyone has one side that's a little bit more loose. So this side on her wants to tighten more. So a little bit of the puckering right there you can see. And we'll go down. See. Now we can release it a little bit there. Still get the same tightening effect. Okay, let me see from the front. Turn this way a little bit. I just really want this jawline super tight because that's what she wants. Okay. All right, look on up a little bit. We're going to cut the threads. Always make sure that you give a little leeway so they all end. Sometimes you can feel them on the end for a short time period. Turn to left, but they dissolve in and it should be fine. In the long run, it'll be fine. Never once had a problem with these. Turn to the right. So we're now cutting the ends. We've already activated all the cones. And then I just want to show her how much we got in a pull. As we're fine tuning here, we're really just taking, like I said, a car for a detail. So this time what I did was we spaced it out here, but then we hooked them together when they came back. So as the time goes on, there should be more of an anchor point by the angle of the mandible. Before we did ones that were a little bit higher, so that was global. Now I focused it to more of a central point. But for some reason, I don't know why, this side is just a little bit more loose and wants a little bit more of a pull. But now at least you'll have the definition on here and here.
Okay.
So you'll be able to see this in the next few weeks.
No, I don't have that like.
No, exactly, that's gone. The marionette, yeah, That's great. So we got a great improvement. She's happy. She also has very realistic expectations and is very good at following the instructions. So she knows it's a building process. So make sure you guys don't freak out when you get these things done and you see a little dimple here or there. It's going to settle. You're going to get improvement. It's going to look good. Just to go to somebody who's an expert. Take care.
Guys, alright, I'm home looking really fucking cute. Oh my god. So did the filler in my chin. Here's where it looks, I guess it doesn't look great, but it will look great. So the dimpling is where they have like a baseline to pull from, so you have like an anchor for the lifting, so your skin will kind of release up over it and like loosen up and go back to normal in the next couple days. But yeah, a little swollen, but no biggie. Yeah, already looking like, oh yes, that hair. Anyways, he is the best. I'm only gonna let him touch my face from now on and my body. He does like lipo, and if you have loose skin, he does things for that too that are more invasive than that laser that I did. But anyways, I love him, and yeah, I hope that was fun or entertaining or anything for you guys. I love sharing, even though I get a lot of comments that maybe aren't the nicest. But I'm not ever gonna stop sharing, and I'm not ever gonna stop doing these things because I'm getting older, guys. I want to look good, okay? Don't hate. Anyways, it's been a long day. I'm ready to chill on the couch. So I will see you guys soon.